Siteman is a national comprehensive cancer center where we specialize in the treatments and care for all different kinds of cancer. Particularly when patients come to us, they receive multimodality care. They are being taken after by experts who specialize in that kind of cancers, and we offer novel clinical trials. So these are the options that I think patients, should receive when they're diagnosed with cancer of any kind. It's not to say that they won't receive excellent care locally, but they have more options here at Siteman Cancer Center. The most rewarding part is being able to be there with the patients, ensuring that they receive the state-of-the-art care they otherwise cannot they can receive anywhere else, making sure that they are properly taken care of, they are respected, and that they're not being abandoned. So I think that's the most important part. Getting a cancer can be a challenging situation for all patients and their families. Being there for them and trying our best to provide them with the care that they need is, to me, of paramount importance. Having family on board is definitely important for the care of cancer patients for a few reasons. Number one, the family can be there to provide mental support so that the patients don't feel that they are alone in the battle against cancer. And secondly, to help absorb information. Usually with first consultation, there's a lot of information that's been thrown at the patients. For somebody who's already at this high stress level, it's really hard for them to absorb further information, let alone technical issues or technical information about the clinical trials and all those things. So having families there definitely would help. And these families would definitely can absorb the information, ask questions that the patient may not think of, and then provide input. The third benefit, I think, is that a family can help reflect the patient's values. So I think those are important things that is helpful in a successful patient care. Colorectal cancer is definitely preventable by early detection. That involves encouraging patients to undergo screening tests like colonoscopy or stool tests. And the important thing is, we know that colon cancer is related to diets and to lifestyle. So I think that if we are able to encourage people to eat more healthily, exercise more, I think we can prevent a lot of those from happening. There's a lot of anxiety when patients are first diagnosed with any kind of cancer, particularly GI cancer. And the first thing we need to do is to assure them they'll be receiving good care. And we are very compassionate physicians. So I think the first thing is to establish trust. That's by showing compassion, to level with patients and to understand their anxiety. Then we introduce to them what we can do here at Siteman. Over the past even 10 years, the treatment for all GI cancer has evolved tremendously. We have come from treating patients indiscriminately with chemotherapy without doing much, now towards a personalized medicine. We take patients' tumor samples, we do genetic testing, we find solutions that are tailored towards these individual patients. And the more exciting part about research in recent years is the advent of immunotherapy. Instead of directly targeting cancer cells, we are now engaging the body's immune system to help with the battle against the cancer cells. As both a researcher and a clinician, it's tremendously rewarding for me to be able to see a difference that I make from the research that I do at the bench. I like to say this all the time. There are many different kinds of research. Some research is aimed at describing a problem, some aim at trying to solve the problems. Although they are all trying to solve the problem, they have a different take at it. So that drives me into doing research that I aim at translating into the clinic for patients, and being able to see that come to fruition, which is what I'm hoping for, is a huge motivation for me. And I think in the current era where there's too much research to follow, the ones that I think will be directly impactful are the ones that can immediately translate to patient care.